Have you ever heard someone say they have arthritis and you may be wondering what type of arthritis they actually have? Now, do you know that osteoarthritis and rheumatoid arthritis are completely different type of disease, although they both affect the joint? Hello everyone, just in case you're coming across my channel for the first time, you are so welcome. My name is Uche into a clinical physiologist. Now today we're going to talk about something very interesting. Is the key difference between this osteoarthritis and rheumatoid arthritis, because some persons, when they ask them, I have arthritis, they don't actually know the difference between these two. So I'm going to be explaining the key difference between these two. Now, arthritis is the inflammation of the joint or disease of the joint, and it causes pain, stiffness, swelling, or even difficulty moving. Now, not all arthritis are the same, because when you hear about arthritis, you think that all of them are the same. No, it doesn't work that way. Now, the two most common type of arthritis is osteoarthritis and rheumatoid arthritis, and they have different causes. Now, for osteoarthritis is the most common type of arthritis. Now, think of your joints and your cartilage like a tire. Now, for those of you that have cars, after years of driving, when you have a particular tire and maybe you don't change it, after years of driving, the tire gradually wears out, right? Now, in the same way, that is how your joints and your cartilage also functions. The protective cartilage that cushion your joints gradually wears out over time. As the cartilage becomes thinner over the years, the bones start to come in contact with each other, and when this happens, you start noticing that pain, that stiffness, that swelling. It usually affects the hips, the knees, the hands, and the spine. Now, osteoarthritis is more common in older adults compared to rheumatoid arthritis. Yes, you heard me. This because I explained to you, just like a car, when you overuse it, right? Over the years or over time, it gets wear out. So the same with osteoarthritis is more common in older adults compared to younger adults, but that does not mean that it cannot occur in younger adults. Of course, it does, particularly those with joint injury, or maybe you're overweight. Now, for rheumatoid arthritis is very different from osteoarthritis. Now, instead of wear and tear, this is more like an autoimmune disease where the immune system mistakenly attacks the cartilage, the joint, causing inflammation, pain, stiffness. Now, this inflammation can damage the cartilage, the bones, even nearby tissues if not treated properly. Rheumatoid arthritis often affects the hands, the wrists, the feet. Unlike osteoarthritis that usually affects the same joints on both sides of the body. Now, for instance, in osteoarthritis, if the right wrist is affected, the left wrist is often affected also. Now, for a quick summary, osteoarthritis is the wear and tear of the joints, just like the tire on a car. When you overuse it over the years, it gets wear out, right? Then for rheumatoid arthritis, it's an autoimmune disease where the immune system mistakenly see the cartilage, the bones as an antigen and starts attacking it, causing inflammation, causing damage to the joint, damage to the cartilage, causing pain, stiffness. Now, if you experience any form of pains, whether osteoarthritis or rheumatoid arthritis, it's advisable for you to see your doctor. Arthritis is not curable, but it can be managed effectively. Now, if you find this video helpful, don't forget to give a thumbs up, like, subscribe, and share. Bye.